In our morning rounds, giving kids the wrong dose. A new study out this morning shows the surprising mistakes adults make at home when giving children medicine. Kids under 6 can become victims on average once every 8 minutes. Our Dr. Holly Phillips is here. Dr. Holly, good to see you.
Good morning,
This
Nora.
is an incredible study.
It really is. They looked at a huge amount of data from poison control centers nationwide, specifically about medication errors that parents make in kids under 6. A huge number of those errors are actually in kids under the age of 1, and overwhelmingly they involve liquid preparations, things like Tylenol or ibuprofen for fever, cough and cold medicines, and antihistamines.
I think some of the challenge, at least for me as a mom, is that when you are doing these liquid applications, there's multiple different, there's teaspoons, there's tablespoons, and there's the syringe. So is some of the mistakes simply in we don't know how to measure what we're using?
Absolutely, Vanita. That's really the largest mistake. Now, sometimes parents actually unwittingly double dosed their children, right? One caregiver gives the medicine and then they don't communicate with another and they end up giving 2 doses. But the biggest issue did have to do with measurements. If you look at the back of some of the medication boxes, it'll call for meds to be dispensed in milliliters, and then the device inside is in teaspoons.
Yeah,
This seems like, go ahead.
I was just saying, I find that all the time. Every single, whether it's Tylenol or Motrin or the generic brand that you buy at the store, they all have different size caps and different measurements. And if you use the wrong cap, you can get totally confused.
Exactly, and actually a common mistake, parents will reach into the kitchen drawer instead and pull out a teaspoon or a tablespoon, and depending on what your silverware is like, you could actually give 50% more. So I actually stole this from my office. I won't say stole it, I borrowed it from my office. I use it for my own kids. It's just a simple syringe. On one side it has the milliliters, on the other side it has teaspoons. And that actually makes it much easier to pull up the medicine and dose it. You can just get this at any drugstore.
That's what I use at my house also.
Yeah.
So is there a way for parents to tell that they've given the wrong dose?
Right. Well, most of these calls, Charlie, were actually parents who realized they gave the wrong dose rather than parents who had very sick children and then figured it out after. If there's ever any question, really the number one thing to do is call the Poison Control Center, your doctor, or take the kid to the ER.
And this comes with all these cough medicines at the same time when doctors are saying we should be pulling back on those, right?
Well, Nora, that was one interesting thing in the study. Over the course of the 10 years that they looked at this data, the number of cold and flu errors went down, and that's because we're giving less cold and flu medicine.
Oh, and that's a good thing.
But so, we still have to really be careful. The most important thing is to realize how easy mistakes are to make.
Yes.
Thank
Very
you, Holly.
important information. Thanks.